Bempedoic acid. Under the esteemed guidance of Dr. Ghulam Jilani, I, Anna Baba, together with my teammates, am honored to present our discussion on the topic of bempedoic acid today. Bempedoic acid is used for cholesterol lowering in statin intolerant patients. The fat-like substance necessary for body to function, but too much low-density LDL cholesterol can lead to buildup in blood vessels, which can cause heart attack or stroke. While several medications exist for the treatment, statins are the most popular, but the prescription comes with some adverse side effects. Statin drugs enter muscles, causing muscle pain in approximately 5 to 10% of people who take them. So, a new agent, bempedoic acid, has been designed as once daily oral therapy. Like statins, bempedoic acid works by blocking a key enzyme used by the body to make cholesterol. But unlike statins, it cannot accumulate in the muscles, reducing likelihood of muscle pain. Patients saw their LDL level drop by an average of about 25% in the clinical trials of bempedoic acid. In patients with elevated levels of low-density lipoprotein or LDL cholesterol, statins are effective in reducing cardiovascular risks. However, adverse musculoskeletal effects make them intolerable for some patients. Recent trials examined the efficacy and safety of bempedoic acid, an ATP citrate lyase inhibitor that reduces LDL cholesterol, for preventing cardiovascular events in the patients with statin intolerance. Bempedoic acid is a first-in-class oral once-daily ATP citrate lyase or ACL inhibitor. Bempedoic acid has an innovative mechanism of action and works in well-known cholesterol synthesis pathway within the hepatocyte, resulting in LDL receptor upregulation and increased clearance of LDL cholesterol from the bloodstream. It's a prodrug converted primarily into its active state in the liver. Acid is a cholesterol-lowering drug. It's inactive when taken orally, but when it gets taken up by the liver, gets converted into an active form, and then it lowers cholesterol by the same mechanism as statins do, but it never gets activated in muscle or any other tissues. This drug reduced the heart-related complications by 13 to 15% and reduced the risk of heart attack by 23%. It reduced the need for a stent or bypass surgery by 19%. So it's great for the patients who could not tolerate statins.